Have you been experiencing hair loss and you're wondering if it's alopecia? That's what we'll talk about today. Hi, my name is Dr. Dwella Moten Nelson, your healthy scalp specialist. So you're wondering, you're seeing your hair that you're losing in the sink and you're losing it in the shower, you're losing it in your comb and your brush, and you're wondering if your hair loss is actually alopecia. One sure sign to know if it's alopecia is you must know the information or you must know exactly what alopecia is. Alopecia is actually an autoimmune disease. It's very different than just having hair loss all over the hair where your hair starts to thin. Alopecia, especially alopecia areata and circular alopecia, normally start out when you are combing your hair and you see little spaces on your scalp where there's almost no hair that's on that area of your scalp. That's how you can be pretty sure that you're experiencing alopecia and not just hair loss all over the head, or just because we do lose more hair as we get older. Hair growth has a cycle, there's a hair growth cycle. So at the end of a hair growth cycle, you will see that you have hair loss or dropping hair because of your hair being at the end of the hair growth cycle. So it's very normal to have hair loss, or when you're at the end of a hair growth cycle, you start to see some hair that might be in the sink or might be in your comb or brush. That's very normal. We're going to lose hair every single day. We lose a certain amount of hair every single day. As you get older, you tend to lose a little bit more hair. So to be able to differentiate if it's hair loss that you're experiencing or if it's alopecia that you're experiencing, you must take a look at your scalp. So, for instance, when you're combing or brushing your hair, if you take your hair and you part it and you're looking down the sections of your hair, if you see any areas on your scalp that have no hair at all, where that hair is completely bald, even the size of it could be the size of the top of an eraser of a pencil, or it can be much, much larger. But start to take a look at your scalp if you anticipate or you think that it may be possible that you have alopecia or you may be suffering from alopecia. That's one way to kind of start to figure out if it's alopecia or just hair loss or just hair loss over time. One thing you could also do is, if you think that it could be alopecia, going to visit a dermatologist. They will be able to help you to determine if it is alopecia, if it is the autoimmune disease that you're experiencing, and not just hair loss all over the head at the time. And the question that we started out talking about is, how quickly does alopecia spread? So the first thing we want to do is diagnose, try to figure out if it's actually alopecia that you're experiencing. I'd like to give you 4 steps that you can take when you're trying to figure out if it's alopecia or how quickly alopecia is spreading. So the first thing you want to do is to determine if it actually is alopecia. We talked a little bit about that, and also we always recommend talking to a dermatologist to try to make sure that it is alopecia that you're experiencing. The first thing we suggest you doing is taking a look at your scalp to see if you see any differences in your scalp. Not just hair loss all over, but seeing if you see any small circular regions on the scalp that do not have hair growth or don't have hair in those sections. That would be your step 1. Your step 2 would be, if you do see those round spots on the scalp, you want to make an appointment to see a dermatologist. They'll be able to diagnose and tell you exactly the type of alopecia you may be experiencing and give you some input and some insight on what they may recommend for you to do to treat your alopecia. Step 3 is you want to start looking for ways that you can keep your scalp as healthy as possible, that you decrease your stress, that you look at your diet, make sure that your whole body is as healthy as possible, because it is an autoimmune disease, which means that you want to keep every part of your body as healthy as possible to be able to fight off this particular type of disease, this autoimmune disease. It means that your immune system is being attacked and it's attacking your scalp. So that's the third thing. You want to make sure that your lifestyle is very, very healthy. You also want to make sure that your scalp is very, very healthy. We find that in order to slow down alopecia, if we find that clients have alopecia very, very early, say if you have 1 or 2 lesions that might be on your scalp, or 1 or 2 areas that are not growing hair, there's some things you can do at home to help that hair to start to grow in. One thing that we love using is a dermal roller. And a derma roller is just a little tool that we provide through Dr. Topic Oils, and it has 540 little tiny needles. If you guys have ever heard of acupuncture, many people use acupuncture for pain, and they use acupuncture to keep their skin very healthy and keep their skin glowing and looking youthful. People use it to diminish fine lines and wrinkles. But you can use a derma roller on the scalp as well. We have found that in our method, we have the AAM method, an advanced antigen method. In that method, we use a derma roller, and that derma roller is used to increase circulation on the scalp. It's used to help to get rid of some of the sebum that's there on the scalp, and it really helps to massage the scalp as well, because good blood flow on the scalp is going to be able to help you to grow that hair back in where those areas are that do not have hair growing. And that's just a part of the AAM method I mentioned before. But to slow it down, that AAM method uses the acupuncture part, which is the derma roller. It uses a application part, which is the nutritive scalp elixir. We apply that to the scalp and then we massage the scalp daily. So that's the AAM method. But to slow it down, you want to use that kind of method where you're using a derma roller or acupuncture to the scalp to increase the blood flow. That'll start to slow down that alopecia. Several people ask the question, is alopecia permanent? And initially at the beginning, when you start to see your hair starting to come out, or you're starting to see areas of the scalp that are bare, that don't have hair there, if you start to look for ways to grow your hair back when it's at the early stages, it's very possible to grow that hair back in or to get that hair to start regenerate. But oftentimes, we don't always go to seek help as soon as we see something going on with our scalp, even with our bodies. And so, in this particular case, when it comes to whether this is hair loss or whether it's alopecia and slowing down that process, you really want to make sure that you're taking a look at your scalp often, making sure that your scalp is nice and healthy, that you don't see inflammation, that you don't see redness and pustules like little pimples that are on the scalp. Those are just inflamed areas that are now have bacterial growth there, and you may have pus on the scalp. So you want to make sure that you're taking a look at your scalp. Don't just assume that it's healthy. If you feel an area on your scalp that is really tender to the touch, take a look at it with the mirror. Take a picture of it with your phone, or get someone that you love to take a look at it and tell you if it looks healthy. But being very vigilant, as soon as you start to see a difference in your scalp, that is how you start to slow down the process, is by knowing exactly what's going on with the scalp to start with. And then if you know what's going on, then you can start to do treatment and start to find ways to keep your scalp as healthy as possible. We totally believe that a healthy scalp will grow hair. So we have helped many clients who have gone through the beginning stages of alopecia to grow their hair back in. You may be wondering if alopecia is contagious. I know when you see people that have alopecia and it seems like their hair, either if they're the beginning stages of alopecia, they may just have one or two areas where the hair is not growing. And some people, when they have alopecia, all of the hair on the scalp comes out. And so you may wonder if it's contagious, if being around someone with alopecia will cause you to have it, or if using a comb or brush of someone that has alopecia will cause you to get alopecia. It is not contagious. Alopecia is an autoimmune disease that cannot be spread from person to person. It's basically within your own body, and your immune system is really vigilant in attacking your cells that are on your scalp. So it is an autoimmune disease, and it is not contagious. And so we hope that this has been really helpful to help you to know how to identify if it's alopecia. Also, what are the steps you should do when you are looking to try to find the help that you need for it? And also, how to slow it down. So, if you have alopecia, how do you keep it from spreading, and how do you keep it from taking all the hair out in different sections of the scalp? So, we hope that this was helpful. Thank you so much for listening. Again, this is Dr. Dwella Moten Nelson, your healthy scalp specialist. Thank you.